So most women will maintain a regular menstrual cycle through their 40s. The average age of menopause is about 52. There's a slender connection when your first degree relatives, meaning siblings and mom, went through menopause, but not a direct relation. Most premenopausal women, as you go through your late 40s and into early 50s, will begin with a prolongation of their cycle. Instead of 25, 28, or 32 days, they may skip a cycle or bleed at longer intervals. It's important to note that if you're having more frequent bleeding, you should definitely bring that to the attention of the gynecologist. A significant majority of those are benign processes, hormonal variations. A smaller percentage might involve skipping ovulation and bleeding irregular and unpredictably. Sometimes there can be growths in the uterus, the majority of which are benign, and those include polyps and fibroids. But clearly, anybody that's bleeding irregularly, unpredictably, or more frequently should approach that topic with the gynecologist. Several of the options at that visit could include ultrasound, could include sampling the lining of the uterus, and at Carnegie Women's Health, we do a procedure called hysteroscopy. Hysterouteroscopy looking. We have a very, very slender camera that uses water to distend the lining of the uterus, and we can take pictures and even sample the lining of the uterus to get to the bottom, sort of one-stop shopping with finding out what's causing the irregular bleeding. Other symptoms that women may have is skipping a number of months at a time. The true definition of menopause is 10 to 12 consecutive months without a period. And it's at that point that you can stop contracepting. The four most common symptoms as one approaches menopause tend to be hot flashes, breaking into a sweat for no apparent reason, mood instability. Many of these women have young children and blame the mood instability on their children, but sometimes it's a hormonal fluctuation. Insomnia, which you can also blame on your children, but is also a feature of menopause. And then vaginal dryness or difficulty generating the moisture or lubrication with regular foreplay, making intercourse more painful. And again, addressing these with the gynecologist is very, very helpful. There is an absolute positive, definite, successful workaround for virtually all of the symptoms. For a woman who's menstruating irregularly and unpredictably, once you make sure that there's not a process going on that needs addressing, like a polyp or a fibroid, birth control pills are perfectly safe. Take well into your 40s, can stabilize the bleeding. For women who are having difficulty sleeping, difficulty with mood swings, vaginal dryness, there are tons of medications available to make that transition much easier. And we also like to inform the patients that a small number of women will begin to go through some of these changes in their early 40s and do that for years and years and years until they go through the ultimate menopause. And that's a classic patient that should come to our office and talk about ways to make that more manageable. Another small percentage of patients will turn 52. The menses will shut off like a water faucet. They won't have one symptom, and they'll go blissfully into menopause. And the rest of the patients will do something in between. As they go through their 40s, they'll skip a cycle or two. They'll notice a little more dryness with intercourse. They'll notice a sporadic hot flash or some difficulty sleeping. But ultimately at 52, we'll go through as easy a menopause as possible. Also, looking at the rest of the body, aside from annual mammograms that our practice recommends being performed from age 40, beginning at age 50, we screen for colon cancer. We arrange for you to consult with a gastroenterologist and get colonoscopy, because colon cancer is a hugely preventable cancer that women, just as well as men, need to be screened for. With the menopause, we also arrange for bone density. Women rely on estrogen to keep their bones strong. Your bone structure is a lot like a brick wall. Throughout a woman's life, a brick is removed here or there from the brick wall, and it doesn't reduce the strength of the brick wall. In the absence of estrogen with menopause, more bricks in some women are removed than in others. And if a few bricks are removed every year, a woman lives her whole life without any manifestation of that. But if lots of bricks are being removed, and sometimes that's a genetic predisposition, if your ancestors did diminish in height over the years, that could represent vertebral fractures. If there's known osteoporosis in the family, that can be a genetic link. If you've taken blood thinners in your pregnancy, there are numerous risk factors for developing osteoporosis. So we encourage all of our young, healthy women to supplement calcium and do weight-bearing exercise, but additional screening as you go through the menopause to find out how many bricks are being removed, because bone loss can be arrested, but it cannot be regenerated. So once you've lost a sufficient number of bones to cause a fracture, you can arrest the loss and prevent it from getting worse, but you can't put bricks back into that wall. And so identifying when it's beginning to get weaker is the time to treat bone loss. In terms of overt symptoms of the menopause, the most difficult to treat tends to be the hot flashes. For a menopausal woman, especially ones that have breaking into a hot sweat several times during the day, and it's lasting beyond months and months and months, is an endorsement for hormone replacement therapy. Hormone replacement therapy with estrogen and progesterone does have a slender link with breast cancer. It may increase the risk of breast cancer 10%. So in those patients, as well as all the others, annual breast screening is strongly, strongly mandated. But we use hormone replacement therapy for patients that have really uncontrollable symptoms of the menopause as an alternative to becoming completely dysfunctional. So please address any of these issues with your doctors. We at Carnegie Women's Health are receptive to any of your queries. Reassure you that some of the findings or some of the things that you're feeling might be normal, and let us know about which ones require further investigation, and we're here for you.